those big bags under your eyes.
I definitely have a technique that can help you.
The doctors take your most aggravating body problems.
This technique takes swollen, sun-damaged skin and makes it smooth, tight, and younger.
And solve them.
I just want to show everyone how dramatic the change is.
All new on The Doctors.
You have tired eyes, but you're not really tired? Well, it's time to ditch those bags forever. Find out how after the break. We're talking about your most aggravating body problems today, and for Erin, it's an aggravating problem she sees every time she looks in the mirror.
I've had these bags under my eyes for 15 years. It's depressing. I've tried tea bags, cucumbers, ice packs, frozen peas, steroids. I went to 3 plastic surgeons. The second plastic surgeon I went to took out a sheet of paper with a face on it, and he had circles on my cheeks and lines and arrows and where he wanted to do injections and BOTOX. By the time he was done with the picture, it looked like a power play for my son's hockey team. I went outside, cried, and called my mom and said, God, Mom, I didn't think I was this homely. It's frustrating to look in the mirror every day and just have these big bags, always.
Erin went to see Dr. Adam Scheiner at the Tampa Eye Clinic.
Go there. And you have a little bit of fullness in this region here in the lower eyelid. It's something called eyelid festoons, but I definitely have a technique that can help you. This is the CO2 laser that we're going to start with. What we're going to do is we're going to go inside the lower eyelid. I'm going to take out just a little bit of fullness. I'm actually using the laser now to very carefully sculpt out just a little bit of this fat in the lower eyelid area. And there's some of the fat coming out there. So now we're actually going to work on the other side. So I'm going through the lower lid. I'm isolating these separate fat pads. We're just sculpting out very, very carefully with the laser. So it looks to me now that we've gotten out the fullness that I wanted to get out. Okay, next. This is going to be the exciting resurfacing. It's called the Cyton Jewel laser. We're going to be able to create some tightness to the skin. I'm tightening the right area of skin. This is right where her festoon is. The last thing I want to do is I want to feather this in because I want this to look natural in the area that I'm working. That is it.
Erin is here with eyelid and facial surgeon Dr. Adam Scheiner. Welcome to you both.
Thank you.
Thank you. You know, and we really haven't addressed this problem on the show before because it's a little different than just those fatty bags under the eyelids, which we've talked about. It's that
And before we get to this, Dr. Orton, I just want to show everyone how dramatic the change is, okay? Before we talk about this. And I want you to look at the camera, and I'm going to show it before, next to your after, so everyone can just see how remarkable and transformative that look is.
Yeah, and the point that I was making is that fullness was down in here, and you call it festoons. Another way to describe it is mailer bags. Has been traditionally a very tough area to treat.
It has. You know, festoons is a medical condition in which the skin of the lower eyelid becomes severely damaged, usually by the sun. This technique takes swollen, sun-damaged skin and makes it smooth, tight, and younger. And as a result, people don't necessarily look tired anymore, and it leaves that skin very smooth, very tight, and very young.
And now you did this on your lovely patient, but you're going to show us how it works.
I would love to do a demo for you guys.
On Mr. Avocado.
Yes. And so we have a laser here, and the audience, I think you have some glasses, if you would put them on. We are not going to be, you're really not at risk for the laser, but this is just for safety's sake, and we're going to put on our glasses too. And what I'm going to do is I'm going to use this laser and compare it to the layers of the skin when I treat my patients with festoons. So this top layer of the avocado, we're going to consider the top layer of skin. This is the first layer that we go through. And as we're going through this, what I'm doing here is I'm really in my patients, I'm creating sort of a controlled wound. And the body is going to heal this wound, and when it does, it's going to grow brand new skin that's almost like baby skin. So at this point, as we're going through, we're seeing the color start to change here. We're seeing a different color, and that's like the middle layer of the skin that we go through. I keep on going, and then very soon here, we're going to start to see the color change even more. And here it is, coming out. It's a little bit of this light greenish color, a little bit of a lime green. Perfect. So we now see a couple different layers here. We see the top layer, the middle layer, and the deep layer. And those are the layers that I go through when I'm treating my patients. That's the layer where I can create new elastic and collagen fibers. That's the layer where I can create this magic.
And of course, what Erin and everyone else...
And you can take off your glasses.
...is if you've undergone this procedure, she looks fabulous right now. Is this something that she would maybe have to have done again, or is this problem solved?
You know, once this is fixed, the great thing, as long as she protects herself from the sun, she can have this result as long as she wants.
And Erin, I'm assuming you're happy with the results because you look fabulous.
I'm so happy with this.
You look great, Erin.
Thank you very much.
Thank you so much. Appreciate it. Coming up, good job. If you or someone...